Good morning, everyone. My name is David Damore. I'm a senior advisor with the Council of State Governments Justice Center, working in Vermont on justice reinvestment, the implementation phase. Good to see you all.
Thank you, David. Next on my list is a telephone number, 802-4 blank, 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 58. Who's that? Somebody is calling in. Could you identify yourself, please?
Hi, that might be me. My name's Robin Joy. I'm the Director of Research for Crime Research Group.
Okay, thank you, Robin. Next is Alan Cormier. Alan?
Good morning, Al Cormier, Chief of Operations for the Department of Corrections.
Thank you, Al. Alice Emmons, please.
State Representative Alice Emmons, and I'm Chair of the House Corrections and Institutions Committee.
Thank you, Alice. Next, Alice Nitka. You're muted, Senator. You're muted. Senator. You're muted.
Mute. Thought I was.
There you go. There you go.
Alice Nitka. I'm a member of the Senate and serve on the Judiciary Committee.
Thank you very much. Allison Hart, please.
Hi, good morning. My name is Allison Hart. I'm with AHS. I'm the Director of Policy and Program Integration. I work in the Secretary's office, and I am supporting the coordination of AHS's efforts on justice reinvestment implementation.
Thank you very much. Angie Gunter.
Good morning, everyone. I'm Angie Gunter. I'm a Senior Research Associate with the Council of State Governments. I've been working with Sarah, David, Madeline, and Loretta on analyzing some data trends and making some policy considerations and phase 2 implementation.
Thank you, Angie.
You all.
Thanks, Angie. Barbara Morrow.
Hi, I'm Barbara Morrow. I'm the Executive Director of the Orleans County Restorative Justice Center.
Great. Thank you, Barbara. Dale Crook.
Yeah, hi, I'm Dale Crook. I'm the Director of Field Services for the Vermont Department of Corrections.
Thank you. David Scher.
I'm David Scher, Assistant Attorney General and Representative of the Attorney General's Office.
Thanks, David. Derek Mio. I'm going to mess this up. Mia, you better pronounce it, Derek. Would you tell us?
That was valiant attempt, Chief Justice. Thank you.
No, it was not a valiant attempt. I didn't even get beyond the first 3 letters.
Attempting it is an act of valiance. I beg to differ.
I like your sense of humor, Derek. Good for you.
The pandemic can't take that away, right?
There you go. I'm with you.
Good morning. I'm Derek Miodovnik. I use he, him pronouns. I'm the Community and Restorative Justice Executive with the Vermont Department of Corrections.
Thank you. It's nice to have you with us, Derek. Thanks very much. Dick Sears.
Dick Sears, State Senator, Bennington County, Chair of the Senate Judiciary Committee, member of the Council of State Governments Justice Center Board.
Thanks, Dick. Emily Higgins.
Good morning, everyone. I am Emily Higgins. I work with Derek in the Department of Corrections. I'm the Corrections Housing Administrator.
Thanks very much. Falco Schilling.
Hi, everyone. I'm Falco Schilling. I'm the Advocacy Director for the ACLU of Vermont here on behalf of James Lyle.
James Pepper.
Hi, James Pepper with the Department of State's Attorneys and Sheriffs.
Good morning. Jim Baker.
Good morning, everybody. Jim Baker, the Interim Commissioner of the Department of Corrections.
Thank you, Jim. Judy Henkin.
Good morning. I'm Judy Henkin. I'm the Deputy Commissioner of Corrections.
Thank you. Julie Scribner.
Good morning. I am Captain with the Vermont State Police and Co-Director of Fair and Impartial Policing and Community Affairs.
Thank you, Captain. Karen Gannett.
Hi, everyone. I'm Karen Gannett, Executive Director of Crime Research Group. We're the Statistical Analysis Center for the state.
And used to work for the judiciary, Karen. Don't forget that.
I did.
Okay, Karen Tronsgaard Scott.
Good morning, everybody. I'm Karen Tronsgaard Scott. I'm the Executive Director of the Vermont Network Against Domestic and Sexual Violence.
Thank you, Karen. Kendall Smith.
Just in time. Good morning, everybody. Kendall Smith, Governor Scott's Director of Policy Development and Legislative Affairs.
Thanks very much. Loretta Sacchi.
Good morning. My name is Loretta Sacchi, and I'm with the Council of State Governments Justice Center.
Thanks, Loretta. Madeline Dardo.
Good morning, folks. My name is Madeline Dardo, and I'm a policy analyst with the CSG Justice Center.
Martin Lalonde.
Good morning, Martin Lalonde. I am a representative from South Burlington, and I sit on the House Judiciary Committee.
Thanks. Mary Jane Ainsworth.
Good morning, Mary Jane Ainsworth. I'm the Executive Director of the Parole Board.
Thank you. Monica Weber.
Good morning, everyone. This is Monica Weber. I'm having an issue with my camera. Otherwise, I would turn it on right now. I'm the Administrative Services Director at the Department of Corrections.
Thank you, Monica. Morning, Fox.
Morning, Fox, Deputy Commissioner, Department of Mental Health.
Matthew Valerio.
Matt Valerio, Defender General.
Thank you. Patricia Gable.
Good morning, everyone. I'm a Vermont State Court Administrator representing the judiciary here.
Thank you, Pat. Representative Kurt Taylor.
Kurt Taylor, I'm on the Corrections and Institutions Committee.
Representative Maxine Grad.
Good morning, Representative Maxine Grad from Washington 7, and I chair the House Judiciary Committee.
Thank you. Robin Joy.
Oh, sorry, I thought I introduced myself. Robin Joy, Director of Research, Crime Research Group.
Sarah Friedman.
Hi, Sarah Friedman, Deputy Program Director with the Council of State Governments Justice Center.
Thank you, Sarah. Sean Brown.
Good morning, Sean Brown, Commissioner for the Vermont Department for Children and Families.
Thank you. And Tyler Allen.
Good morning. I'm the Adolescent Services Director for the Department for Children and Families.
Thank you, Tyler. So that's my list. Is there anyone who joined late or somehow I may have missed? Would you speak up, please?
Sure. Jay Pershing Johnson. Oh, I'm sorry.
Go
ahead.
Thank you, Jay. It's good to see you. Who else?
This is Eitan Nasreddin-Longo. I keep getting signed out. I am the chair of the Racial Disparities Advisory Panel and co-director of Fair and Impartial Policing and Community Affairs for the Vermont State Police.
Okay, maybe Sam Griffith can help you. Sam?
I am having a hard time finding. There's a lot of people in this call. Can you speak one more time so I can see you?
Eitan Nasreddin-Longo. Hello?
Are you phoning in, Eitan?
No, I'm not. I'm on my computer.
Oh, I do see it now. Yeah, there's a lot of boxes here. You said you keep on getting kicked out?
Yep, 4 times now.
Gotcha. It might be something with the internet that you're using, the bandwidth. I'm going to send you a message on the chat just so we don't disrupt. But if you just look on the bottom right hand, you'll see a message coming in from me.
Okay. Thank you.
All right. Thank you.
Thank you for speaking up. Appreciate it. Thank you, Sam. Anybody else?
Chief, this is Brian Grierson. I'm not on video. I'm only on the phone.
Okay, thank you. Thank you, Judge Grierson. How about now?
This is Susanna Davis, Racial Equity Director.
Oh, Susanna, good. Good. It's nice to hear your voice. Thanks for joining us. Who else? Anybody else?
Gary Marvel, Department of Corrections, Field Operations Manager.
Okay, thank you, Gary. Anyone else? Okay. So we're ready to start through the agenda. Any other housekeeping matters? If people have questions or comments they want to make along the way, I know Sarah and her colleagues have made this point repeatedly in our prior meetings and also in the conferences that we've had with them to get ready for these meetings. That they would like to be interrupted with questions. You don't have to wait to the end of the presentation. They have PowerPoints and would welcome your questions. I will tell you that I will try to keep track of the hands. I don't know if there's a hands function on this. I suppose there is somewhere. Usually there is. Anyway, speak up. That's my recommendation to you. If you have something you want to say, just unmute yourself and go ahead. I think that is it on the, unless someone has a question, I'm going to turn it over to David Damore, who's going to present first with the PowerPoint. David?
Good morning, everybody. Let me share my screen and we'll get started. So everybody should be seeing a full screen of our slides. If that's not the case, Chief Justice, please let me know. Again, good morning. Great. Again, good morning, everyone. My name is David Damore, and along with my colleagues, we will be presenting some information this morning as we continue our work with the state of Vermont. There's going to be two themes as I talk and get into the behavioral health piece. The first one that I say sort of at the beginning of every time that I have a conversation with folks is that generally speaking, it is likely that by the time I'm done, I'll have annoyed everybody at least once. That is generally the case. And if I haven't, then I probably haven't done my job very well. The second issue, second theme is that there isn't one place, one department, one person, or one policy that will solve all these issues. It requires an integrated approach in ways that Vermont has done some things well, and in other ways has continued to respond in some siloed ways. And so I'm going to be consistently saying that when there are different problems, that even though that problem may exist in a particular area, it may not be that area, that department, that group of people that can solve it, because it's bigger than what any one group can take care of. So I need to start out, of course, with our usual discussion to sort of briefly tell everyone that, of course, we are with the Council of State Governments Justice Center. I'm going to make a suggestion. There may be some folks that are not muted at the moment, and so there's some background noise. It may be helpful to be muted if you're not speaking in order to keep the background noise down. Going back to the fact that we're the Justice Center, part of the Council of State Governments, we're a national nonprofit, nonpartisan organization. We combine the power of a membership organization, serving state officials in all three branches of government, with policy and research expertise to develop strategies that increase public safety and strengthen communities. The way that we work is by bringing folks together, much like this morning. We drive the criminal justice field forward with original research. We build momentum for policy change, and we provide expert assistance both through our staff and through consultants who work with us. Our goals are to break the cycle of incarceration, to advance health, opportunity, and equity in the justice system, and to use data to improve safety and justice. Justice reinvestment is one of our central components, if you will, in the work that we've been doing in Vermont. The idea of justice reinvestment is fundamentally simply to reinvest in what works rather than waste resources on things that don't. It's a data-driven approach to improve public safety, to reduce corrections and related criminal justice spending as appropriate, and to reinvest the savings in strategies that can decrease crime and reduce recidivism. The initiative is supported by funding from the U.S. Department of Justice's Bureau of Justice Assistance, or BJA, and the Pew Charitable Trusts. So this morning, my piece will be sections 1 and 2, reviewing the working group priorities, and talking about section 22, behavioral health report. And then we'll move after that to Sarah and other topics. So as a review, and excuse me, let me just move my screen here just a little bit. There we go. As a review, working group members are focusing on specific statutory duties before the first reporting deadline, which is January 15th of 2021. In the September 30th working group meeting, the members prioritized these tasks for October 2020 through January 2021. 1, to study earned time for people on probation and explore other related policy items. 2, to identify ways to increase the Department of Corrections and community provider risk and needs assessment information sharing, to help inform plea agreement, sentencing, and revocation decisions. 3, to determine screening, assessment, case planning, and care coordination gaps for folks with complex behavioral health issues that are in the criminal justice system, and to recommend system improvements. And 4, to identify new or existing tools to identify risk factors that can be targeted with treatment and services. All right. And for some reason, just a moment. There we go. This is the third of 4 working group meetings before the January 15th, 2021 reporting deadline. As you can see, there will be another one in January. The idea through all of these meetings is to create implementation strategies and to implement policies that have been already passed, as well as to determine data measures and measure that impact over time, which will be extremely important in terms of looking at all of these policies and changes that may occur. The working group will address these tasks prior to the reporting deadline. Today, we'll continue the discussion of probation earned credit. We'll continue the discussion of behavioral health information sharing, case coordination, case management protocols, and service challenges for folks that are in the criminal justice system. We'll also consider justice reinvestment funding and appropriation recommendations for the upcoming budget cycle. In January, at the January 11th meeting, there will be additional implementation updates and discussion of reports that need to be submitted as per Act 148. There'll be a review of the policy options related to previous working group conversations and reports. And there'll be a discussion of any follow-up information related to the AHS report on behavioral health, as well as determining what future meetings of the working group would be appropriate to schedule and to follow through with. So with that overview, I will now move into Section 22 Behavioral Health Report with some information and some thoughts and some suggestions for folks. I'm going to start with the fact that when we look at people that are entering prison on a supervision violation from 2017 to 2019, what we find is that those folks were assessed as higher risk and need than the overall supervision population. Now, that a couple of things. First of all, that level was determined by using the community supervision tool. For those of you that don't know, the community supervision tool is part of a suite of assessment tools that is part of what's called the Ohio Risk Assessment System, or ORAS. And there are several different tools in that system. One of them is the community supervision tool, looking at risk and need levels of individuals who will be on supervision and pointing out what those particular issues might be. Now, one of the important things about this piece of information is this is exactly what you would expect. What it tells you is that the department is doing a good job in terms of assessing individuals. It makes sense that when you look at supervision violations, that you're going to see people who are higher risk rather than lower, or at least a greater number of them that are being violated, as opposed to those that are on lower risk. So that indicates sort of two key things. The first one is that indicates a good piece of assessment on the part of the department. And the second thing is that it suggests that indeed officers are responding to those individuals who are higher risk. Now, having said that, that is not to say that it's a good thing that we have the supervision violations or the number of them that exist. But that has nothing to do with an inappropriate assessment of the individuals and has more to do with system issues that we will talk about a bit as we move forward. And this is another piece that is one of those system issues. Over half of the people that are entering prison on a supervision violation who were assessed using the prison intake tool, or the PIT, which is another tool in the ORAS suite that I was just mentioning, report having a previous mental health diagnosis. So one of the things that is very clear is that one of the drivers of people failing on supervision and ending back in prison has to do with mental health issues. And when you look down here, You see this in terms of furlough violation, you see it in terms of probation violation, and you see it in terms of new court commitment in terms of significant numbers. And you certainly see a high percentage with parole violations. Your numbers are lower just because of the numbers of folks that are under these different types of supervision, but nevertheless, the percentage is significant. So one of the things that this tells us is that one of the drivers of people failing in the community has to do with mental health issues. In addition, almost 60% of folks that are entering prison for a supervision violation show indications of a moderate or high substance use need. And so again, when we talk about a moderate or high substance use need, this has to do with the substance use related domains that are on either the CST or the PIT and a particular score. And when we look at this, what we see is 67% of folks on furlough, 48% of the folks on probation. And we don't have exact numbers here in terms of parole and new court commitments, but you can see that there's a fairly significant piece there as well. Now, a couple of things here that I think is extremely important. What this is a hint that there's a problem. It's not to suggest that we have all the information, because we don't. There would need to be additional assessment. But the fact that these folks show up on a risk and needs assessment pretty clearly suggests that it is a major issue in people failing on supervision. So when you look at the previous slide and this slide, what you see related to both is that failures in the community are strongly related to mental health and substance use need. Now, many times those failures in the community, the intent of the violation is to protect that individual and to protect the community. The intent is exactly correct. The problem is that the result, the solution to the problem is ineffective. It's not the right solution. And we'll talk about that a bit more as well. Of the 903 people revoked or returned from probation or parole and placed directly on furlough from 2017 to 2019, 51% subsequently returned to incarceration or detention. So look at this: probation or parole, go to a supervision violation, go direct to furlough. Over half of them end up detained or incarcerated. What it tells you very clearly is that furlough for folks with these needs is not the answer. Now, a couple of things that have to be very clear here about. The first one is, when I say that, I'm not picking on furlough. I'm certainly not picking on the department. What's happening is that throughout all of this system, people are taking what is available to them and trying to respond to the need. What you have is a hammer in place. That's the furlough. What you need is a laser scalpel in terms of responding to these issues. What you need are better responses in terms of your substance use and mental health difficulties that these individuals are having. It is not possible for intensive supervision without those things to be effective. And so it is not a failure of the individuals or a failure of the department's response per se. It is a failure of what does not exist and what needs to exist in order for individuals to be successful. Act 148 directs the Agency of Human Services to work with CSG Justice. Whoops, excuse me. It's always a plan not to lean on your keyboard. Act 148 directs the Agency of Human Services to work with the CSG Justice Center to report current behavioral health assessment, case planning, and information sharing practices. Section 22 in particular directs the Agency of Human Services to provide the following information to the Justice Reinvestment 2 Working Group by December 1, 2020. Current assessment and screening processes, including how assessment results inform case planning for people who are incarcerated, and preparing to re-enter the community, or on probation. Existing behavioral health collaborative care coordination and case management protocols that serve the corrections population, and challenges that exist in information sharing between service providers and the Department of Correction. AHS, with the support of the CSG Justice Center staff, took a collaborative cross-system approach to gathering the information required. Now, while AHS is required to report by December 1, ongoing information gathering is going to be necessary to inform conversations ahead of the January working group meeting. We have had some meetings with the departments that you see here, the Department of Correction, Department of Mental Health, ADAP, Alcohol and Drug Programs, and the Department for Children and Families. We've had both individual meetings and group meetings with everybody together. And we've begun to attack these issues, and you'll hear a little bit from Allison Hart in a little while about some of that. But we have more information gathering to do, and we have more thinking to do in terms of how to resolve the challenges that exist. And so I very much see that we'll be continuing those meetings past next week, past December 1st. People with behavioral health needs in the criminal justice system often require access to an array of providers and services. Again, part of what I was showing you earlier is that there isn't a one-size-fits-all response, and there isn't one thing alone that will solve the problem. When we look at folks in the criminal justice system with behavioral health needs, states really need to ensure that there's access to the range of treatment and services that are necessary to adequately, successfully address those needs. And when you look at this, you can see in this circle all of these potential issues that exist: substance use disorder issues, mental health or psychiatric issues, transportation issues, supported housing issues, specialized supervision, certified peer supports, recovery support services, correctional programming, that's risk reduction programming, and then case management, which should help pull all of these different pieces together. In Vermont, what that means is that a person on furlough or on probation or parole may in fact interact with several different providers across departments under AHS. People on supervision with behavioral health needs, people may need to be involved with the Department of Correction and the Department of Mental Health. If there are children involved in their family, then the Department of Children and Families may need to be involved. If they have a co-occurring disorder or a substance use disorder, then ADAP or the Department of Addiction and Drug Treatment Programs may need to be involved. And so there are actually relatively few people, frankly, that are involved with the Department of Correction who are only involved with the Department of Correction, or who only have needs that the Department of Correction itself can resolve. And there are a small group of those individuals, those people who are exceptionally low risk, which there are not a lot of in the department, and who don't have other needs, or those folks who might in fact have a fair degree of what we call criminal thinking, that the risk reduction programming alone will resolve, but don't have these other issues. But honestly, I can probably count those on both hands and both feet. That's a very small number of individuals. The Vermont correctional system has overwhelmingly people with complex needs, complex interrelated behavioral health, mental health, housing, mental health, substance use, housing, and financial employment needs. You have done a wonderful job of not pulling in a lot of low risk, low need individuals. But what it has left you with is a degree of complexity that, quite frankly, is extremely challenging to respond to. In terms of responding to look at those issues, the first thing that we look at, of course, is that issue of assessment and screening. People must be screened for mental health and substance use needs at all stages of the criminal justice system. And for those who screen positively, that person then needs to be assessed by a trained clinician who can reach a diagnosis. Data needs to be collected, recorded, and shared, which is one of the issues. But when we talk about screening and assessment, we're starting at the very beginning, emergency response and law enforcement. We're talking about the courts, of course, jails and prisons, as well as probation and parole supervision. So through what's called every intercept in the system, I think that it is extremely important the evidence tells us pretty clearly it's extremely important that folks are screened and assessed throughout all of that so that we can begin to attack those problems, resolve those needs as early as possible. Now, one of the nice things about Vermont is that you already have most assessment and screening processes in place for identifying substance use and mental health needs. You've got folks who are detained, you have a substance use screener, you have a mental health screener. For those who are sentenced, you have those screeners, follow-up clinical assessment when appropriate. Same is true for furlough. For probation, you've got a substance use screener for people direct to probation, follow-up clinical assessment when appropriate. There is not currently a mental health screener in place for folks who are going directly to probation. That is something that we are strongly recommending needs to be fixed over time, that needs to be added to that initial assessment that folks get when they're going directly to probation. There are a number of challenges that exist to ensure assessment and screening results inform case planning in an appropriate and effective way. According to DOC policy, case plans for people on community supervision will be informed by behavioral health information that's identified by screeners or assessments. But the reality is that case plans are not always informed by the behavioral health needs of the client. And there's a number of reasons for that. One may have to do with resource constraints in a particular part of the state. One may have to do with court-ordered stipulations, that the stipulations either don't match or require things that aren't needed, quite frankly, or do not require things that are needed because those stipulations may not have been made with the necessary assessment information available to the court. And then again, in some cases, there may be a limited service availability. The supervision staff do have access to behavioral health information within the reentry case plans in order to understand the behavioral health needs of people moving from incarceration and supervision. Case plans for people who do not receive MAT or who are not identified as having SMI, however, may not always reflect other types of behavioral health needs. The upside is that for those folks who are absolutely the most serious in terms of substance use need and serious mental illness, there's folks who are doing a really decent job, a pretty good job of responding to that. But the reality is that, again, that's a fairly small number of what is a complex population. Many folks have moderate substance use needs, and many folks have a variety of mental health needs that don't rise to the definition of SMI, but are extremely debilitating and cause those individuals massive difficulty, increase their failure exponentially, and they need to be responded to as well. Sometimes those are called responsivity issues, but whatever one calls them, not responding to those issues dramatically increases those individuals' risk of failure in the community. It increases the danger, if you will, to themselves. And depending on the specific issue, it may obviously also impact public safety. One of the other challenges is that assessment and screening results are not consistently shared between DOC, healthcare contractor, DOC facility, reentry caseworkers, and supervision officers. That's what we mean when we say DOC, and the community-based providers to inform case management and case coordination. And again, there are a variety of reasons for that are not all DOC specific. Some of them have to do with improvements that DOC can make, but some of them also have to do with how community providers do or do not interact with the department. Case planners can actually facilitate interagency collaboration and information sharing. When somebody is in the criminal justice system, the lead case planner realistically is the community supervision agency. And that community supervision agency in a system that is working effectively has the ability to interact with all of these other folks in the circle, including us, obviously the participant, his or her support system, children's service agencies, medical provider or providers, substance use treatment provider, mental illness treatment provider, the courts, correctional facilities, voc and educational providers, specialized housing providers, and peer support. I wasn't kidding when I said you have a complex population and the responses to those individuals need to be equally complex. That complexity involves the better integration of these different individuals. So lead case planners are the agency or provider that takes the lead in case planning and management, such as a probation or parole agency or a behavioral health treatment provider or a correctional agency. And they oversee that process and engage the appropriate people from each partnering agency, as well as each participant and their support system. Now, Vermont does have treatment case planning policies in place, but people are still inconsistently connected to community behavioral health services. There's challenges to sharing relevant behavioral health information and coordinating the care between DOC and community-based providers, and that can negatively impact overall case planning, as well as subsequent treatment and programming referrals. Those challenges, again, are all over the place. And what I mean by that is the resolution to those challenges has to be a system resolution. It's not something that DOC can solve by itself. And frankly, it's not something that community providers can solve by itself. And it's important to understand that. Some DOC supervision offices have indeed built strong relationships with local services. They're able to leverage those those connections to help the clients connect with the available services. That's not consistent across Vermont, however, for a variety of reasons, including what's available, including different relationships, et cetera. So it results in geographic variations in care coordination, just as you all talk about there being geographic variations in terms of the criminal justice response in general or the court response. The same is true in terms of care coordination. Due to funding limitations and challenges in care coordination, folks with mental health needs who don't rise to the level of serious mental illness can be underconnected to the continuum of care that's offered by designated agencies for mental health in the community. For people with co-occurring disorders who are on MAT, there's often a lack of coordination between the mental health folks and the supervision folks. All right, let me say that differently. Lack of coordination between the mental health folks, the substance use treatment folks, and the supervision folks, right? It gets even more complicated when you're looking at folks who have both mental health and substance use disorders. In reality, a person's behavioral health information should move with them throughout the justice system so that it can inform ongoing case planning and decision-making, starting at the court, key information sharing partners under each of these boxes, right? Starting at the court, that information is necessary to share appropriately between DOC and the courts. In terms of institutional programming, DOC and the healthcare contractor. In terms of reentry, the case managers, the supervision officers, and the community-based service providers. In terms of community supervision, again, the officers, of course, and the community-based service providers. In terms of violation and revocation decisions, supervision officers, parole board courts, and the community-based providers. And it's not just the sharing of information, to be clear, in all of these cases. It's a determination of what is the appropriate information to be shared. I've sat in on multiple meetings, multiple parole board hearings, et cetera. And there is an inconsistency in that information sharing that, again, has to be handled at a system level. There is no one department that can solve this by themselves. And I know that I sound like a broken record, but it is key to Vermont being successful. If this falls on any one department, you will fail. It's just that simple. And then parole, supervision officers, and between the supervision officers and the parole board, extremely important, obviously, in terms of decisions the parole board needs to make. Information sharing, well, ensures that a person receives the type and level of intervention that is necessary for increasing supervision success and for reducing the likelihood of reincarceration. Now, information that, when shared, can support collaborative case management and care coordination includes the results from assessment and screening, past treatment and programming, current treatment and programming, future recommended treatment and programming, medications, if applicable, familial and social supports, strengths and challenges that the individual may have, and responsivity factors. And responsivity factors, simply put, for those who may not be familiar with the concept, are what are those things that either enhance a person's ability to respond to interventions or get in the way of a person's ability to respond, and what do we do in order to increase their potential to be successful? Some of that has to do with how we present, how we work with folks. Some of that has to do with differences in terms of gender, differences in terms of ethnicity and race, differences in terms of age, differences in terms of learning style. There's a lot of different things that play into that. So when we talk about responsivity factors, we are basically talking about how do you get through to people. On the simplest level, even in this webinar here, some of the folks that are on the webinar are auditory learners, and you're listening to my words. And some of you, my words are not very meaningful at all. That's not how you learn, and you're really happy that what you have in front of you is a screen that you can read the information. And some of you may be experiential learners. You learn by doing, in which case this is a difficult 3 hours for you because we're not doing. We are talking and we are showing you things. Behavioral health information sharing between DOC and community-based providers and the parole board is inconsistent across the state. Current information sharing between supervision officers and community providers tends to be based on the relationships rather than established processes or policies, and therefore it varies widely across the state. And again, when I say established policies, I don't mean specifically DOC policies. I mean overarching policies between all of the agencies in AHS. AHS does not currently have an umbrella information sharing policy that governs how its departments share information to support folks with behavioral health needs in the criminal justice system that are served by more than one department within AHS. And there are inconsistencies in the type of information shared between supervision officers and community providers to support case planning and care coordination. And in fact, to put a finer point on that, because that makes it sound like that it's a one-way street. When I say information shared between, I mean not just from officers to the community providers. I mean equally the information from the community providers giving necessary information to the officers to be able to be more effective in responding to the particular needs that their individuals have, or to be more understanding of why the individual they're supervising may be behaving in a certain way, and that it's not related to them being resistant or to them being wanting to be difficult, but it's related to their particular behavioral health need. For folks that are sentenced straight to probation, as I mentioned earlier, there is less behavioral health assessment and screening information available to inform the supervision conditions than for people that are transitioning to furlough or parole. And as a result of that, judges often don't have the necessary information to ensure that conditions of supervision address both the criminogenic and behavioral health needs, particularly for those folks that are sentenced directly to felony supervision. The minimum information that should be available to inform supervision conditions include substance use screening results, mental health screening results, criminogenic risk and needs screening or assessment results, and criminal history. And again, this is a system issue. It is not just the issue of, oh, DOC, let's add the mental health screener, which is really the only thing that DOC doesn't have in this particular case, and they have all the other things in place already. It's not just that, it's also the issue of, at a system level, the court system having discussions about, is this important information? Why is this important information? How do we think about integrating this into our decisions? I spoke to a number of different judicial folks when I was traveling about Vermont, and quite frankly, what I got were very different opinions about whether or not they took that information or were even interested in having that information in terms of decision making. I think that it's important that there be a variety of discussions to at least try to make it clear across the system why those things are important, how they relate to improved community safety, and how they relate to improved success of individuals who are on community supervision. Now, there are some jurisdictions around the country that have indeed expanded the use of assessments to inform the setting of supervision conditions. In Colorado, they have what they call probation investigations. All misdemeanor and most felony cases are referred for a probation investigation that includes the risk and needs assessment results and recommendations for supervision conditions. To be clear, this is different than the full PSI that some folks get right now in Vermont and in other states. The ability to do that on everybody would be just impossible. The resources that it would take, the cost it would take, the person power that it would require is undoable. But that does not mean that there isn't a less difficult, less onerous process to make sure that all of that information gets to the judges. Arizona does something slightly different called a pre-sentencing report. All felony cases are required to receive a short pre-sentencing report that includes risk and needs assessment results and relevant social history. Now, Vermont does face several challenges to improving information sharing and care coordinating. There are some real limitations related to federal privacy laws and regulations, including the Health Insurance Portability and Accountability Act, or HIPAA, and 42 CFR Part 2, the Substance Abuse Privacy Act. But there are also a lot of perceived limitations. In my work around the country, I have found that in most systems, there's a poor understanding of HIPAA, and that HIPAA and 42 CFR Part 2 are often used by systems, community providers, mental health systems, substance use systems, are often used to justify tremendous siloing and lack of information sharing. While there are limitations, there are less than what most people end up suggesting exist. And so while you cannot simply share everything, there are multiple systems that have figured out how to share the appropriate and relevant information to assure that the right information follows folks so that they get the right care as they move throughout the system. There is inconsistent knowledge among DOC staff, parole board members, and other criminal justice stakeholders regarding evidence-based practices in serving people with substance use and mental health needs. By inconsistent, what I mean is not everybody has the same level of knowledge at this point. And I have talked to people with massive knowledge, and many of them. But you also have folks that need additional information, need additional training. It's nothing bad about them. It's information they don't have. And it's extremely important because when you have a large number of people being supervised with the significant behavioral health needs that your population has, when you have a large number of those people having difficulty on supervision and returning to the parole board and potentially being violated, when you have a large number of people returning to the courts because of these issues, not having a consistently high level of knowledge about these issues results in the failure that you're seeing, where the solution too often is we'll just return them back to DOC, whether that's through furlough or through incarceration. It's a little unfair to DOC, quite frankly, because they can't solve that problem. You send them back for 30 days, you send them back for 60 days, you send them back for 90 days. That 30, 60, 90 days will not resolve those complex needs. And if, in fact, that 30, 60, 90 days isn't specifically targeted at figuring out what's going to happen when those people return to the community and that they get the right supports there, then you've spent a lot of money and interrupted somebody's life with very little outcome or impact. In addition, part of the problem, and part of the reason that folks are doing this with the best of intentions, and I want to be clear about that, is because there's also inconsistent knowledge among community-based providers in terms of serving people in the criminal justice system. And I've heard this in talking in every part of the state, frankly. And one of the challenges is to make sure we get the community-based providers, and particularly the designated agencies, fully up to snuff, if you will, in understanding how to deal with folks who not just have complex behavioral health needs, but also have the criminal justice related needs. So when we're talking about housing needs, when we're talking about substance use and behavioral health needs, one has to understand how to provide those responses in the context of this person being a criminal justice client and therefore not always behaving the way that we want people to behave. And the problem is that we then end up terminating those folks from the very services we need. Sometimes the way I talk about it is that too many services want people to have done about 60% of the work before they'll take them. That makes no sense. Our job when we're working with these folks is to understand the work they need to do and to provide those services in a way to get them where they need to be. If, in fact, they were capable of just doing that themselves and we could do the finishing work, then frankly, they wouldn't need us and they wouldn't be in the system in the first place. And so we need to rethink our approach to that for those folks who don't traditionally, if you will, work with criminal justice clients. Now, in fairness, the other issue is that there tends to be a lack of resources in some areas across the state. And so it has nothing to do with knowledge or not lack of desire or lack of interest or people not wanting to make the referrals or not making the referrals. It has to do with there isn't a place to send those folks. And so again, part of the thinking there as we move forward is, first of all, expanding telehealth issues, of course, further, or telehealth access further, and then really maybe considering some other way to look at regional or satellite kinds of responses where you do have less available services. And there's a lack of resources right now to increase information sharing in order to inform supervision conditions pre-sentencing, meaning, again, we can't simply lay everything on officers and say, now do 10 more things in order to get this information to judges. The working group prioritized 3 interrelated areas of study regarding behavioral health. One is identifying ways to increase DOC and community provider risk assessment information sharing to help inform plea agreement, sentencing, and revocation decisions. And I've touched on that. How do we add to this without overburdening the department? 2, to determine screening, assessment, case planning, and care coordination gaps for people with complex behavioral health issues in the criminal justice system and recommend system improvements. And 3, to identify new or existing tools to identify risk factors that can be targeted with treatment and services. And again, one of the nice things about number 3 is that the fact is that overwhelmingly those tools exist. And they are used well. You can see the relationship between those risk levels and the problems of folks on supervision. So that makes a lot of sense. Again, that's not the problem. The problem is being able to have the right group of individuals providing the right responses to those folks to decrease failure, or more specifically, to increase success. During the first phase, the working group considered several policy options that could be revisited to inform the upcoming report, using validated behavioral health screening tools for all folks who are sentenced to incarceration for any period, and to add mental health screening questions to the supervision level assessment tool for people on probation, to standardize the behavioral health and reentry information policy and procedures between DOC, contracted healthcare staff, case managers, reentry officers, the hubs and spokes, designated mental health agencies, and other community service providers, and to develop care coordination and case management protocols for executive agencies that serve people with behavioral health needs who are under DOC custody. To increase information sharing policy option for felony probation cases, explore how risk assessment and behavioral health information can be efficiently provided to judges before sentencing to better inform supervision conditions. I'm going to actually now stop. Thank you for your attention to this point. You've been great. And I know there have been a couple of questions that have come in that I simply could not read and respond to at the same time, but I'm now going to turn this over to Allison Hart from AHS, and that will give me an opportunity to take a look at any questions that may have come in. And Allison will now cover a few things on the next slides, and Allison, I will move them forward for you.
Great, thanks, David. So yeah, good morning again, everyone. So I've been working closely with CSG, as I said, to really coordinate the agency's response to justice reinvestment. And I really want to say at the outset that the Secretary strongly believes that any sort of problem that's identified at corrections is really a problem at the agency. And we want to obviously ensure that people are not going back to corrections for those 30 and 60, 90-day interrupts that David talked about. We want to make sure that when they leave corrections, that they are fully supported in the community. And we really believe that it is our agency's job to do that through our various departments, and that it can't be just up to the Department of Corrections. I guess along these lines, I want to say that, you know, the Secretary has prioritized a number of the things that we're looking at within Justice Reinvestment, especially information sharing across departments, really ensuring that we are, you know, busting a lot of myths around HIPAA protections, ensuring that everyone understands that we can share information in a lot of circumstances. So we're working on that. We're also, as you all know, really aligning care coordination within our agency. We see this as a way to improve the supports that we provide to Vermonters. And lastly, we are, you know, with healthcare reform, are really working to align ADAP and Department of Mental Health with payment reform. So all of this is very aligned with the goals of Justice Reinvestment. And David, I think you can go to the next slide. So in terms of coordination of care and information sharing, we have just a couple of opportunities that we're working on within the agency that I thought I would highlight, because I think that they really complement and respond to this work. One is the work that we're doing with the Vermont Chronic Care Initiative. They are folks that coordinate care. You may already know this. They coordinate care for folks with very complex needs identified in the Medicaid caseload. And so they're working with corrections to identify folks who do have complex needs on their way out of corrections to really coordinate their care for them. We also work with our field services directors, are also working very hard to coordinate the sort of human services, social service support that folks receive on the way out of corrections. So I think between sort of the sort of primary health care focus of VCCI, along with the human services approach of the field services directors, we see there's a lot of alignment there in what we can do to support people holistically. You can go to the next slide, David. So also along the lines of information sharing and coordination of care, we understand at AHS that a lot of our services are based, when we look at people, we think of them as a point in time. They're in corrections today, or they're in the homeless system, but we know that that all of the Vermonters that we serve at the agency really touch all of our systems for the most part. And right now, we're really working on understanding that better, understanding the needs of the complex issues of Vermonters by really looking at how a cohort of folks have moved through homelessness to emergency behavioral health services to incarceration. So that's one thing that we're doing. We're able to flex our sort of agency system-wide information sharing muscle with that project. Also, sort of closer to the ground, if you will, we've talked extensively with our general counsel about this concept of a universal consent that would really allow our AHS departments to coordinate care at the sort of district level for individuals. And our general counsel believes that that's really doable for us to get to that. Just it's very, it's a lot of work, and obviously we have a lot going on, and so we haven't been able to get too far on that, but that's definitely a goal and something that's in the works. I think that could be my last slide, David. Not sure.
Yep.
Okay.
Thank you, Allison. So while Allison was talking, I had the opportunity to take a look at a few of the questions that were coming in that I was not able to look at while I was talking. And so I'm going to try to respond to some of them. One of them has to do with you mentioned that 51% are failing on furlough, 49% are not. Could that be a glass half full? I mean, isn't it a good thing to say that 49% are succeeding? And the answer is no, it's not. 51% failure rate is not acceptable. 51% failure rate is almost twice as high as where you want it to be. And at the very least, you want to get it down to 35% as opposed to 51%. And so, no, I would argue it's not a glass half full, if you will, but that while it is good news that there are people that are succeeding, you need to get the failure rate down. And then the next question becomes, well, gee, what's the difference between those people who are succeeding and not? And while I don't have that information specifically, statistically at my fingertips, we actually can do that. But the sort of logical point that I would make is that if you look at the slides that look at the mental health and substance use needs, and you look at the percentage of individuals that have those, and you look at your failure rates in terms of furlough, then it's a pretty logical argument that it is those individuals who have the increased mental health and substance use needs that are having the more difficulty in terms of surviving. And that does generally, what's the word I'm looking for? That generally jives with the information that I already have or that we already have. Angie is going to pull some additional data and narrow that down a little bit better to see if we can give you one-to-one comparisons about that. We think that we can do that, and we will work on that between now and the next time, excuse me, and the next time that we chat. Another question was asking me to expand a little bit on geographic discrepancies and disconnect between designated agencies and DOC. So all of these are all system issues. So first of all, geographic discrepancies. Some of the differences across the state have to do with the differences in the relationships between the agencies, the designated agencies and the Department of Correction or the local office specifically. Some of it has to do with the existence of programming, meaning a geographic discrepancy occurs simply because it does not exist. There's a difference between how somebody in place A gets a response versus how somebody in place B gets a response. And so that's one reason that you see those discrepancies. The other thing is that what you see in terms of the different geographic discrepancies and the relations between the designated agencies is that, one, there are differences in how the designated agencies look at the issues. Two, there are differences in the relationships between the agencies and the local office. This is nothing bad about any of those folks. This is about the fact that there isn't a system-wide process and policy and training that looks at how to assure that there's a consistent set of responses, interactions between all of these system actors around these issues. And so part of what we strongly are urging is that things be developed in a way that no matter what office you are in, no matter what agency you are in, you are working from the same playbook, if you will, and from the same templates. And so that there's a greater degree of consistency about that. That doesn't throw out relationships, and one always has to look at relationship development, and time has to be spent. But I think it gets much more difficult when folks don't feel like they have the necessary clarity or playbook in order to assure that those pieces go consistently across each part of the state. And forgive me because I'm reading messages coming in at the same time as I'm trying to say this, which is probably not the most effective. Looking at just another question that's come in, there's a question about the overlap between domestic and mental health responses, or a comment, and important that it be recognized and systems developed to include community level mental health specialists and domestic violence, sexual violence services providers. And I would absolutely agree with that and support that. Very quickly, let me just say that having been around for over 40 years, when we first thought about our responses to domestic violence and sexual violence, we were operating from the best information that we had at the time. Unfortunately, a lot of things have become sort of stuck in stone. And what we now know is that when we're looking at people who commit domestic violence and when we're looking at people who commit sexual violence, the way that we've sort of carved them out as being so incredibly different than everybody else in the criminal justice system doesn't actually hold up. Their behaviors are different, but a lot of the drivers and a lot of the responses and a lot of the needs that they have are the same as many others who are involved in the criminal justice system. Too often, what we have done is created a separate set of responses. And while those things may also be needed, we took away from them the other things that would make them successful. And so we've ended up, to me, it's a bit ironic. I would argue the two largest groups of people we are and should be the most worried about, those people who commit physical violence, intimate partner violence, family violence, and those people who commit sexual violence, people we are the most worried about, we have created multiple systemic responses that get in the way of having them do well. And that is unfortunate. So I'm thrilled to hear that there's conversation happening between domestic violence and mental health folks. I would encourage that the conversation be expanded in terms of sexual violence folks as well, if it isn't already. And in response to the other, I apologize. I did not mean to suggest that you were intending to suggest that 50% was good. I was merely responding to the sort of the statistical issues, if you will. And I think that that's all the questions that I see. So I think for that, we'll just now go to moving away from those questions. For the working group, I think the information we would like to ask you, and before we break, is what additional information, if any, do you require regarding how folks in the criminal justice system with behavioral health issues are currently identified and served? And looking at the one of the questions again about the breakdown between the 51 and the 49, we will work on that and get that information back to you. But are there others, as well as other recommendations that you would like to consider at the January meeting? And I'll throw this open now, and Sarah and I are happy to respond to any additional questions or recommendations about what we should be continuing to work on.
Thanks, David. Anybody have comments or questions? Well, we're scheduled for a break at 10:25. It's about 10:15 now. We could break now, come back at 10:30. If you have questions, write them down and we'll take them up as soon as we get back. But without hearing any voices or any objection, I think David and Sarah, what we'll do is take a break now. Come back at 10:30. Okay, thank you very much. Okay, we're about to get going. People coming back, I hope. All right, it's 10:30. Let's get started again. I know Commissioner Baker had a comment he wanted to make. Jim, go ahead, please.
Chief Justice, thank you for recognizing me. I just want to thank you for that overview that you provided, first of all. I think it's very helpful for me, being new to corrections. Some of that stuff that we all know about, and I think slide 13 was probably the most impactful slide for me. And I think if folks take a look at that again, it really tells the story of why we have the failure we do in that 50 percentile in the community. But I wanted just to get your sense of a couple things, David. My sense in corrections is that the very high risk folks, a lot of attention in the system, and we tend to deal better with the very high risk individuals than we do with the population that I would describe and my staff would describe as that mid to lower high risk range of individuals. Would you agree with that thought?
Yes, for a couple of reasons. One is from a volume perspective, you're going to have less of that group. And how do I want to put this? When you get to that highest level of risk individuals, there are in reality only 3 or 4 things that you can do. And it really is sort of you have to have a heavy presence and respond. For those people that are in that moderate high range, you tend to have way more of them. And somewhat ironically, they tend to have more, how do I want to put, your highest risk people are your biggest criminal thinkers. And so your traditional response to criminal thinkers you can do. When you get to that moderate high risk individuals, they tend to, while their criminal thinking tends to be a little lower, their overall needs tend to be more complex, which drive the problems and the behavior and make them more difficult to respond to. So yeah, I would agree with you.
And that piece that you talked about, information sharing, correct? You're not proposing that as a solution as much as a strategy as part of the overall solution for better outcomes, is what I gather.
Yes, just sharing information will not make the change. What sharing information, appropriate information, does is that assures that you have a coordinated, collaborative response among all the appropriate actors who are attempting to make the change or help this individual make the changes so that they can be successful in the community. Information sharing by itself won't get you there. Lack of information sharing hog ties everybody from doing the things consistently and coherently in response to the problem.
And my last question, Chief, and I promise I'll end it here.
No, these are good questions, Jim. Please.
Other people to speak, but David, my experience, and again, for most of the folks that know me a lot, it's not from corrections, it's from law enforcement. But information sharing works best when you embed people together on the ground level where the work is being done. So do you have any experience or any knowledge, for example, I've talked offline about, we're talking a little bit inside corrections about potentially embedding our own mental health workers inside our district offices, right? But as I listen to the presentation today, it brings me back to some of my prior work in my law enforcement career. It almost makes sense that we would embed designated agency mental health caseworkers inside our district offices. Do you have any experience at that? Because that would start to address a lot of what I heard you talk about today. Not the only answer, but a big step in the process moving forward, having that type of embedded resource working side by side with our probation and parole officers. So I'll turn it back to you for a comment.
Short answer is yes. More complicated answer, let me, so not to talk about me, but when I worked in the real world, meaning when I was doing direct service stuff, one of the things that we developed back in the late 90s, early 2000s, was a collaborative response for people who were committing sexual and domestic violence. And it was a 4-part component that included the treatment providers, the specialized treatment providers, the behavioral health treatment providers, and in Connecticut, that is both mental health and substance use under one agency, the supervision officers, probation and parole, which are under 2 agencies in Connecticut, and victim advocates. And that was our team. That was our coordinated team. And much of the work was done, frankly, in the supervision offices as opposed to in other places to show that sort of coordination. We embedded victim advocates in the offices. We embedded treatment providers in the offices. So although you didn't know this about me, that in fact is something that I strongly believe. Now, there is one cautionary note. And that cautionary note is that there has to be incredibly strong leadership. Otherwise, there becomes an enmeshment among the different disciplines. And you have to be careful. You don't want treatment providers to become supervision officers. You don't want to make believe supervision officers are treatment providers. You don't want victim advocacy telling supervision officers how to supervise. So there have to be clear boundaries, and there has to be strong leadership to ensure that there is not enmeshment among. But if you have that in place, then you are genuinely talking about a systems response. And it doesn't have to be embedded there. That's one place to do that. But that is an truly integrated collaborative response. Again, with the caveat, there must be strong leadership and clear boundaries.
You know, I'd be interested, David, and again, Chief, if you would just indulge me.
Yeah, please.
I would be interested, David, if at some point we could get some type of presentation about a model like that in your experience that has worked.
Sure.
I'm just a firm believer that embedding resources and people standing around a water cooler, working through issues, getting things done quicker than from the top down. So I'll stop there, Chief. Thanks for the time.
Thank you, Commissioner. Thank you so much. David, you got another comment? Yeah.
I would simply say happy to do that, and not just this model, but there are some others similar around the country. We can certainly put something together that would be hopefully helpful.
Well, how about other folks before we get going on the next item on the agenda? These are good questions and good points to consider. Do other people have comments they want to make about these ideas that the commissioner put on the table and David's responded to? I'm looking at the chat box. I don't see anything.
Oh, I was just gonna.
Yeah, please, Jay. I see your hand.
So I was just, I mean, I think it's great. I mean, I do know that, you know, we proposed embedded mental health resources in the Vermont State Police Barracks this last session. And I know it became very controversial when a number of advocates were saying, I think expressed that enmeshment concern that David pointed to. But I think that at the end of the day, there was general agreement that not doing it was probably worse than trying it. So I guess that's the kind of thing that we don't get stuck in some sort of inertia as we think about these ideas. And so I think it would be helpful to look at models, and if there are any, how successful they are, and you know, how do we avoid pitfalls. The other thing, I had sort of it's not unrelated question, but one of David's slides went to this idea that about 2/3 of the supervision violations related to substance abuse and I guess related behavioral issues. And the intent is often to protect the individual and the community, but generally our response is not effective. And I was wondering what relationship that has to our MAT system. I know that it's also a very high proportion of inmates who are on MAT in the institution. Is there to the point of care coordination, how do we fail so spectacularly on releases to the community for substance abuse violations when we are providing MAT theoretically effectively in a controlled environment? I guess that's my question.
Well, so several sets of responses to that. The first one is that what the data tells us at this point is that those folks that are failing have those needs. It does not specify specifically why they were violated, though there's, of course, a strong face valid that there's some kind of correlation, at least, if not directly. So that's issue one. Issue two is MAT is incredibly important, but it is not a magic bullet. MAT by itself, when you have a series of complex needs, will not solve all of your problems. And the other thing is to remember that what you have here are a series of individuals with relatively complex needs that include high criminogenic factors and also a number of mental health needs. And so what you have are a combination of factors. So MAT could be doing and I don't have this information one way or the other, but just to be clear, MAT could be doing exactly what it should be doing. Risk reduction programming could be doing exactly what it should be doing. Mental health programming could be doing exactly what it should be doing. The problem is that when they are not provided in an integrated way where people are able to connect those different pieces as well as you can, even when you're doing something really well in one of those systems, it can fail in another. And so that's what happens. And one of the things I think back to with years ago with substance use treatment, we used to get into this big thing of you have to do the substance use treatment for a year and nothing else can be paid attention to. And so they were doing and I'm going back 35 years just to be clear, but so they were doing really good work, but the people were failing because their mental health need or their criminogenic need wasn't being dealt with. And then the reverse was happening too, which is no matter how good your risk reduction programming is, if the person is psychotic or if the person has significant mental health needs, it's not going to be effective. So it's less an issue of is each place not doing the best they can? They may be. I mean, every place can improve, but they may be doing very well. The problem lies in that lack of interconnectedness that needs to be further developed, which is another piece back to that issue of the information sharing and the better involvement and decision making about how these things connect and interact together, which is why the commissioner's idea about connecting with the water cooler conversation, for lack of a better way of putting that, why that makes a lot of sense. There are different structures to do that, but that kind of ability to talk about, look, this is what Jim needs. And yeah, I know he needs the criminal thinking, but if we don't get him stabilized in terms of this psychiatric issue, it doesn't matter how good the criminal thinking program is. It's great that he's been stabilized with mental health care, but if we don't deal with the fact that he thinks the solution to everything is to rip people off criminal thinking, then we're not going to get where we need to go. And so it's that integrated response that gives you the power that you're looking for. You can do the best you can in every division, mental health, substance use, criminal thinking, and you can, in those different areas, you can lower the criminal behavior by, at best, about 25%. In order to increase that approval, or rather decrease the criminal behavior further, you have to figure out how to integrate the different approaches that we know make sense. You need to think of that person in a more, I hate to use this word, but in a more holistic fashion. And I haven't even touched the issues of housing, food, medical, I'll stop.
Okay. Thank you, David. Thank you very much. I think we're on the clock and we need to move on. And I appreciate the comments and the questions and the responses. Sarah, you're up next, please.
Thanks so much, Chief. I'm going to share my screen now. And let's see that. Here we go. Everyone can see this. Hopefully that All right, do we have a PowerPoint up full screen? Okay, so I'll be taking over the second half of the presentation from David. And this is really for us to revisit the probation earned credit conversation that was started in the last meeting, but due to kind of a lack of time, we didn't really get to have the working group didn't get to have an extremely thorough conversation on. And then to talk through a potential reinvestment funding and what recommendations are to support Act 148 policies fiscally. And then quickly, with time allows, just some next steps, talking through the report that's due from the working group to the legislature and the January meeting. So this section actually will be a little different than what you all have been used to from CSG presentations, in that it is short. You saw our analysis on probation last meeting, and I'm not going to rehash it here. We don't have an additional analysis. I'm just going to remind you all of what you were talking about last meeting so that we can continue that conversation. So here, if you remember, this is a slide from the last meeting. There were 4 primary goals we discussed on what a probation earned credit policy might aim to address. And so remember, this was a conversation of, is there a way to create a structure within your probation sentencing system where folks who are successful on probation can earn time off of their sentence? But what does that look like? Probation sentences have 3 different components to them. They have the length of time someone is placed on probation, and then also underlying sentence that has a minimum sentence and a maximum sentence. So, how do you structure that as the conversation? And what's the point of considering a probation earned credit policy? Well, a lot of folks on this working group in Vermont really think that the goal of a probation earned credit policy should be to decrease the length of incarceration for people who are revoked to prison when they fail on probation. So if folks were successful for a period on probation, but then end up going back to prison because of a supervision violation, they should get credit for some of the time that they were successful on probation. Now that's decreasing that underlying incarceration sentence, so the amount of time that someone would spend in prison if they're not successful on probation. A probation earned credit policy can also decrease the term for people who are successful on probation. So as someone is being successful on probation, they can earn credits so that they're on probation for a shorter period of time. Probation earned credits also have been shown, as you saw last meeting, they've been shown to increase the incentive for positive behavior change. So people will work towards being successful on probation if they know that if they're earning essentially a shorter span of their sentence, which can help, which has public safety benefits as people are working towards good behavior. It also, we talked about, increases probation resources available. So if you're getting people who are successful on probation and complying with all of their conditions, if you're getting them off of the probation rolls, then your supervision officers can focus on the people who are not complying with their supervision, who are not successful, and you can really free up resources to work with those people who are at highest risk to reoffend and people who are not doing well on probation. So you'll remember from that conversation, or just as a reminder, we looked at a whole bunch of data around what's going on with how Vermont's probation sentencing works and when people are generally on average go to prison on supervision violations. And for both misdemeanor and I think it's really key just to remember that for both misdemeanor and felony probation sentences, people who go back to prison, who mess up, do so well within the first half of their probation sentence. And really for both misdemeanor and felony probation, they go back generally within the first year on average. Someone who messes up on their probation and goes to prison does so within the first year of their probation sentence. I think it was 8 months if they're on average around the 8-month mark if they're on misdemeanor probation, and the 11-month mark if they're on felony probation. So within that conversation, working group members discussed a variety of different policy options related to how a probation earned credit policy or early discharge would be structured, would work. And this is really with the policy options discussed here, or the policies that were kind of thrown out in the last meeting or throughout other conversations between Vermonters. We're really trying to tackle that goal of decreasing that length of incarceration for people who then go back to prison once they violate their supervision. So there's been conversations about applying a probation earned credit to the underlying minimum sentence, applying probation earned credit to underlying minimum sentences, but not letting that minimum sentence get down to zero. So reserving, stopping the credit accrual at say 15 or 30 days to ensure that there's some sort of minimum term of incarceration available if someone needs to be revoked. There also have been conversations about applying the probation earned credit to both the underlying minimum and maximum sentences. And then CSG initiated the conversation last meeting that, another way that's really common that other states deal with this, not related necessarily to strictly a probation earned credit policy, is many states across the country have instituted revocation caps. So when someone is revoked from community supervision, they don't go back for the entire remaining term of their underlying sentence. Instead, that time in prison is capped, sometimes at 30 or 90 days. In some states, it's also longer if they're being revoked for a technical violation. Also, last month, the working group discussed kind of that idea of earning discharge from the actual probation term, the time that someone is on probation, and that could be integrated into an earned credit policy. But there were two other policy options that were discussed last meeting, which was strengthening the midpoint review process that already exists in Vermont to make it more presumptive and make sure that the state is really taking advantage of that tool that's already in your toolbox. And then also we discussed a few state examples, and I think one that came up a couple of times was an earned discharge policy similar to Montana's conditional discharge from supervision. So that's if someone is on probation for a certain period of time, has been successful. In Montana, it happens to be based on risk, depending on their risk to recidivate, they can petition the court to get the rest of their probation discharged. So this is the drumbeat that you heard me and David talk about last meeting, and David has already touched on in this meeting, but just want to remind everyone that, regardless of how and if you create an earned probation policy and change that structure of earning credits on probation, you still need to be really focusing on other supervision improvements to tackle the issue of reducing technical violations that result in prison time. So we know that you all heard a lot about this during phase one of our process from David and Ellen, but that there's a lot of work to be done in Vermont on strengthening the effectiveness of violation responses for people on community supervision through graduated sanctions and the use of incentives. And DOC is actively working on that right now. So that's something that you all have going on right now. And then, as you've heard David talk about in this meeting, just a few minutes ago, you also need to make sure that you're supporting people with behavioral health, mental health, and substance use needs who are on community supervision. So increasing your understanding of those needs and making sure you're targeting services to them. And then, of course, overall increasing the community-based resources available for people on supervision to get criminogenic mental health and substance use needs. So you're hearing a little bit of a repetition from David earlier today, but just to remind everyone that if the overall goal is reducing time people spend in prison on revocations and reducing technical violations, there's a lot of work to be done within community supervision systems on there. And that work is underway right now. So now we have the questions for discussion, and this is where actually I'm going to not share my screen anymore so you all can see yourself, at least for right now. I can't see any of you. But I'll read these first. But I'm hoping, I know that there's a lot of people on the working group who have thought a lot about this earned credit discussion, who have been having who chimed in last meeting, but also have been having discussions, outside of working group meetings, and who were involved in discussions during the last legislative session on these probation earned credits. So I do want to toss it out to all of you to discuss, and I want to make sure you can see each other. But we're just really hoping that, we can today talk through any policy options related to this probation earned credit that you would like to consider and perhaps propose move to the legislature moving forward. If anyone has any opinions on how you'd like to approach the reporting to the legislature on this issue, we're all ears. And there is also a conversation is the working group voting in the next meeting on this? So I'm going to stop sharing so that you all can see each other to really have this conversation. But of course, I can always share and refer to a slide if someone would like to point to a slide that we have. So I will kick it off here, and I hope that someone will volunteer to go first and give their thoughts on probation earned credit and how it might be structured, and if it's needed.
I'm willing to go first and take the heat.
Thank you. That's wonderful.
Sarah, thank you. And I really think that the Montana example is one that we should pursue legislatively. It reminds me some of the juvenile system where you have a review at some point where the judge makes some kind of decision whether to continue treatment. I think it's a year. Commissioner Brown may remind me of what the period is, but it seems like at some point that Montana idea it's solving well on probation. It seems like they ought to have the opportunity to go to the court and ask to be discharged, and then at that point, the state and DOC and others can enter into it. But I wanted to also comment on, I guess one of the things with David's presentation and with your presentation, I'm reminded of unequal services around the state. For example, here in Bennington County, we don't have a methadone clinic readily available, whereas in other counties they have that service. So when we talk about the services for people that are on probation, furlough, or parole, there's also agencies, are they capable of dealing significant change? They're only interested in staying out of jail. So, their motivation may not be similar to someone who is actively working to solve a substance abuse problem, for example. So I think there's a lot of that. So I like David's comment on that as well. But I think I'd like to pursue the Montana example. It seems like it has an opportunity to lessen technical violations, and particularly people that have done well for a period of time. I think anything after 90 days, they're less likely to be violated on probation. Well, I'll kick those two thoughts off, and thank you.
Would it be helpful if I just reminded folks what the Montana example is? I have a feeling, yeah. So Montana, as part of their justice reinvestment legislation, in 2017 passed SB 63, which actually require DOC to recommend people for conditional discharge from community supervision. And it's set when DOC makes that recommendation based on the person's assessed risk level. So it ranged from 9 months for folks so 9 months successfully on probation supervision, and actually parole in Montana too, on both types of supervision. If the person was low risk, up to, for people who were highest risk, 24 months successfully on supervision. And when they hit that time, if they kind of are in good standing, supervision officers help the client petition the court and recommend discharge for the person. Once they receive the petition, the judge makes a decision on whether to grant discharge, and per the statute, the judge must determine if the discharge is in the best interests of the person on probation and society, will not present an unreasonable risk of danger to a victim, and also they have a requirement that the person has to have paid all restitution and court-ordered financial obligations in full in order to get that discharge.
Sarah, this is James Pepper from the Department of State's Attorneys. How is that Montana example different than our midpoint review process that we have in statute?
You know, it actually is not, it's not so dissimilar, other than anecdotally, and just as a reminder, we couldn't get data on this. We just don't know if the midpoint reviews are actually really being used. But it is, the midpoint review also, you know, in Vermont, it's rather than a length of time based on your risk, the risk of the person, it's, you know, at the halfway point of their probation sentence. That there's a petition to the judge to, you know, to kind of evaluate if that person is being successful on probation, and then can be discharged. So you do have a mechanism like that, but it's not really clear. That we weren't able to get data on it, and you know, I think people have the anecdata. It might be all over the place on this as to whether anyone is being discharged at the midpoint review process.
And is there data from Montana at this point, or is it just too new of a process?
You know, it's we're working on that, but we don't have anything that we can use right now to figure it out. Montana did have, I mean, it's important to note, Montana did have some implementation challenges that I don't think that Vermont will have, but the way the statute was initially written had the supervision officers petitioning the court, and in Montana that was determined that I'm not a lawyer, so apologies if I get this terminology a little messed up, but that supervision officers essentially couldn't act as be an actor in court, and so they did have to modify it, how they implemented it. My understanding, especially with the midpoint review process, is that's not actually a thing in Vermont, and probably could be done as originally designed.
So this is a question maybe for Dale or Commissioner Baker or Sarah, if you know. The midpoint review process, that was created as a tool, but what happens to that now in statute? Is it something, how is it designed to be used in statute?
So what the midpoint review, it requires a probation parole officer at the month prior to the midpoint of a term of a probation case that has a term to do one of three things. If the offender has completed all their conditions of supervision, is to make a recommendation for discharge to the court. If they have completed some but not all of their conditions of supervision, they can make a recommendation to reduce the term of the probated term, or do nothing if the offender hasn't really accomplish much under supervision. Now, those are only recommendations, and those go back to the originating court. And some of the courts have different review processes based on the courts are a little different. Some, they go through the state's attorney first, and they make a determination. Some, the judges, they generally will have input from the other players before a discharge is done. This kind of comes into what Senator Sears was saying, that there's discrepancies between all the different geographic areas, as some states' attorneys are more agreeable to approving a midpoint review discharge, and others are not. So it's really, it kind of goes down to that area where there are differences throughout the state. But the policy is in place, and the Department of Corrections and our staff have to follow that rule. So we don't, there's some areas that won't do a discharge early, but we still have to make those recommendations. So hopefully that clarified the midpoint review. But I do think, I do agree with Sarah that it's probably very similar to what Montana was doing. And the one thing with Montana is they use, they're probably a little bit more evidence-based, as they're using risk as a factor, and when to make the discharge. Now you could probably say that obviously individuals that are lower risk will be more successful and would be able to be more likely to be discharged at the midpoint. So it may not be a strong evidence, because just behavior and the risk will make individuals more or less successful.
Yeah, I would just have to say that, and obviously I'm not an expert in this area, but just listening to these conversations, it seems to me that from the last meeting, my notes were that the Montana process was part of a comprehensive package. It's not entirely supported by the data. They had implementation issues, and it's not exactly comparable. It sounds like we might have a system in place that with some fixes could be more effective and do the kind of thing that we're talking about. And again, getting back to discharging for the sake of discharging, when I think we should, the real focus, as David has discussed and Sarah pointed out again, is meeting the needs of the clients we have to provide the most appropriate evidence-based services to reduce recidivism. So again, I don't know that release for the sake of release is, the intent, but I think that we still have that question of when we release into the service, into the communities, if we're providing those services effectively, and that maybe should be our focus.
I think another thing just to note for you all is, I think that many people on this call and the CSG team definitely would agree, like the less people, the goal is reducing our criminal justice system, and less people under correctional control safely is how we would want to do. But you need to make sure you're doing it in ways that reduce, the risk that new crimes are committed. I think that these earned discharge policies are really important, and can be this really good tool to incentivize people to kind of change their behavior, and in that kind of evidence-based way that they're working towards something, they're earning it, and they do really promote good behavior while on community supervision. The conditional discharge would cut people who are successful, it would cut their time on probation supervision shorter if they're successful. And then, of course, once they're off probation supervision, they cannot be revoked to prison, and they wouldn't, have like an incarcerative liability. It would not touch that underlying sentence of revocation. So for when folks are revoked, especially on technical violations, it wouldn't reduce the amount of time that they might spend in prison if they are not successful on on supervision, which was also part of the conversation you all were having previously.
Could I weigh in?
Please.
I surveyed our offices regarding the midpoint review. And as far as we can tell, the current system really has no meaningful impact on reducing the number of people on probation, even when it seems that there are people who would be eligible for discharge early. Usually, if someone wants to get early discharge, it's as a result of a motion by defense counsel, and they have to put on a case and convince the court, as opposed to the more administrative way of looking at things that I think that the midpoint review is supposed to be working for. So, our concern obviously is that there are some people, and I think there would be no dispute about this. The question is who are they who are on probation who don't need to be, and that those people, if you leave them on probation long enough, are going to run afoul of probation conditions, and they end up feeding the system back. But if they were off probation, you'd probably never hear from them again. Excuse me, just as our current system is set up, we aren't really seeing any meaningful impact of the midpoint review.
This is David, if you don't mind my weighing in here for a moment. As one of the entities that had been working on the original proposal, for better and possibly for worse, we did just want to note that this seems, well, I guess two main points I want to make. I think that original proposal, which, as Sarah pointed out, dealt with the underlying time, was ultimately, it appears, a proposal that was a bit more confusing than it was helpful to addressing some of these issues. And I think something along the lines of what we're talking about, which seems to be essentially making a midpoint review more uniform and strengthening that process such that it becomes more of a default where appropriate, as evidenced by somebody's performance on probation and risk assessment, making that process be uniform across the state, making sure it happens across the state, and making sure that, as Matt Valerio points out, a sort of administrative decision around that can become an administrative decision that weighs those factors can become a more controlling decision, we think would be appropriate and a reasonable way to go forward, and frankly sounds somewhat similar to the Montana system, just with a Vermont label. And I would also say that I think Jay Johnson's point is an important one for us all to remember, which is that these procedural changes are important. We did push this forward, and we continue to be believers in a reform along these lines, perhaps this midpoint review, because there does seem to be the data does show an inconsistency in incarcerative or reincarcerative responses between probation and furlough, where the probation reincarcerations are longer, which is odd, given what you would expect from the difference in severity or risk for why somebody's on probation versus furlough. So all that being said, we did think that some procedural fix is appropriate, and I think that something along the lines of what we're talking about, essentially a strengthened midpoint review, is appropriate. And I do also want to bring forward Jay Johnson's point again, which I think is important, which is that this doesn't address some of the key things that we need to do around making sure that we are providing the resources and the programming that people need to be successful. Procedural changes are much easier to make because they don't come with an upfront price tag. And that's, I think, why we are proponents of them. I mean, we certainly have, as everybody on this call knows, we've certainly been strong proponents of many procedural changes, and we do think they have a real effect, but they're not everything. And it's important to, I think for us all to remember that this procedural change, which again I think is appropriate, isn't going to address some of those underlying needs that we have and that David Damore spent a long time talking about this morning. So just wanted to speak in support of something along these lines. I think it's a good way forward. We don't need to be wedded to the proposal as it was a year ago. And also that as we're thinking about these things, we need to be open to addressing some of the more resource intensive needs to make sure we're keeping everybody safe and people need the resources or people get the resources they need.
This is Dale. I would agree with what David just said. Remember, probation is, for most of our population, the initial entry system into the criminal justice system. That's really where most individuals come through at. And the better that we can focus upfront activities where we can kind of better identify and address the needs of that population and then provide the services that we need, the funneling effect will be reduced and we'll have less people coming through our system for a longer period of time. And there's a lot of evidence around dosage probation about, once someone has completed their needs and risks through supervision, continuing supervision is not beneficial. So there's a lot of components out there. I think looking at a midpoint review or earned discharge credit is just one component of the entire process that needs to happen with probation, just with probation itself. I know David Damore has talked about doing risk assessments up front, identifying better conditions that match the risk and needs of the offender, which would better address the probation and parole officer's ability to address those risk and needs through treatment, because we have the conditions that will reinforce that. So I think this is just, I think, one important component in a much larger system that GRI is kind of looking at. And this is kind of probation's kind of turn to be looked at. Remember, most of the population under the Department of Correction is on probation right now. So it is our biggest group that we're responsible for.
So I just like to chime in quickly on all of these issues and say, I think we 100% agree with the idea of trying to strengthen a midpoint review. But I think in the conversation we're having, just to note Sarah's comments, that in itself does not address some of the underlying liability issues for incarcerative liability. That was one of the impetuses behind this conversation in the first place, where someone might have served the majority of their sentence in the community, have a violation, and then have a much longer sentence to serve in an incarcerative setting. So I don't want that to be lost in this conversation. And also some of the concerns around parity for folks who are on different statuses of community supervision who have the ability to earn time while in the community. So I just want to make sure that we aren't losing those things, but also to second the idea that we would support strengthening the midpoint review section.
And I think I've heard DOC agree with that perspective, that people are incarcerated for too long, essentially, by the way that our system is set up. I mean, is that correct, Dale? I mean, have you, because I just feel like that is not, I think, a hurdle that some alternative approach like strengthening midpoint review. I mean, I think another thing I heard at the last meeting was that Vermont's one of the few states that doesn't have review of probation by the court. I don't know where that fits into the picture, but I think that there are some things it seems like we could look at our own system now to see where we need tweaks to make some of these fixes that probably many in the institutions themselves would agree are necessary.
Yeah, I think actually Falco said it pretty well when he said that there's really different standards based on the supervision that you're on. So, we have furlough, probation, and parole. So if someone spends a year in a community supervision, only 2 of those supervision statuses are actually earning time toward their maximum sentence. The probationer is only earning time toward his term sentence of probation. So if after a year, all 3 of those cases all get revoked and they all had the same sentence to begin with, the probationer will actually have a year longer to serve because that supervision time kind of didn't count. If that's really not the best word, but it didn't really count. So that was the impetus last year with the conversation about the credit time, is to make the different supervision statuses kind of more equal. The supervision provided by the staff is the same. We're a risk-based supervision. So higher risk individuals, we get more resources regardless of the legal status. Really, the legal status for a probation officer just tells us where to send paperwork and who's going to make the decision. That's really the difference, and the conditions that are established. But how the state, I guess, credits or views the time on supervision is different based on the 3 different statuses.
And just to go back to a point that Jay originally made when I'm thinking about this and how Montana did do this as part of a comprehensive package of reforms aimed at community supervision. But Vermont is not so far off from that. You also have been looking at how to improve your community supervision system and reduce technical violations. Montana did this as part of requiring their officers to change their responses and use graduated sanctions, a matrix of graduated sanctions and incentives to work towards the same thing that Vermont is doing, using 4 incentives for every sanction. And earned discharge, as I've said, is essentially the ultimate incentive for people on community supervision. So it kind of works within that structure that Vermont is working on. Along with just general community supervision reforms that you're thinking of. I know that they've been very, so maybe the conversations have been focused on the furlough from phase 1 of justice reinvestment, but there are things that we think should be done for all 3 of your community supervision populations, those changes in responses. So that is part of the policy package. The other thing that Montana did, along with doing the graduated sanction grid, which Vermont is working on, this earned discharge policy, they also did the revocation caps, which I mentioned in the last presentation. So if you're being revoked solely for technical violations, you can only go back to prison for a set amount of time, not for the entire length of your additional sentence. But just to point out that this isn't necessarily in a vacuum. If you're looking at the trajectory of your justice reinvestment process, it does fit in with those conversations you all were having with Ellen and David around graduated sanctions and improving supervision responses. So I don't see anyone in the chat who's chimed in, and I don't see anyone here, but maybe we'll sit in awkward silence for another minute in case something comes to folks. In case anyone wants to chime in with some additional thoughts before we move to the next section of the presentation. I don't want to rush you all, and it's really hard on video to know when a conversation might be finishing.
Well, Sarah and I had the conversation about the Montana system a while back with others. So I do plan to introduce a bill based on the Montana system, but it would be great to have the backing of the Justice Reinvestment 2 working group. in pursuing that. And of course, when we do that, we'll have all kinds of testimony from all kinds of folks in that process. And it may not be, it may not end up being the Montana system, but the best Vermont system in the nation. But I think that's a good way to start this off. I think we need to deal with, I think Dale pointed it out so well. You take a person on furlough, take a person on probation, and take a person on parole, and the one on probation is facing the longest sentence because they've gotten no credit from their sentence. I agree with David Scher that his original proposal was extremely complex, and providing good time would have been difficult. But I think this is a good starting point to start to have this discussion.
If I can follow up on her, Sears, this is Alice Emmons. When the legislation came over to the House side, my committee was very supportive of it as a way of really of working people through the system, giving them some support, and stopping folks from coming into the incarcerated door if they're successful on probation. So speaking from the House perspective, we would support something along the lines of really looking at credit for time served one way or another with folks who are on probation, because that is the feeder system into our incarcerative setting. And our committee, my committee, was very supportive of it. We had questions, we worked it through, but we're very supportive of the concept. And it would be a tremendous help if this working group, if Justice Reinvestment group could come and support a form of really looking at credit for time served for folks who are on probation. That would help our work in the legislature quite a bit. So thank you.
So I wonder actually if I can ask a procedural question to you all that may show my naivety on how Vermont works. So apologize, but is this something that the working group would then vote on either today or in the January meeting on whether or not they support this? Is that kind of how that would go, or is it just something that generally, we can put in the final report as this is a conversation that was had? I wonder how folks would like the follow through on this issue.
I appreciated the way we did it last time. I don't remember taking a vote, but I know that CSG made some evidence-based, data-supported recommendations that I think there was general consensus around. So I appreciated that approach last time. And correct me if I'm wrong, I'm not remembering a vote.
I'm not big on having a vote because each one of our constituencies and each individual, we're going to go into the legislature, whatever gets introduced, and we're going to take whatever position is consistent with what our role is. And I don't know that a vote here would be particularly meaningful.
Fair enough. Well, we can certainly summarize this conversation and kind of flesh it out for the next presentation for you all to review. Okay. Are we ready to move on to the next section of the presentation? I'm seeing a few nodding heads. Now's your time to object. Okay. I'm going to go back to sharing my screen, so I won't be able to see you all anymore. So of course, feel free to, and as David discovered, the presenter can't really see the chat either. So, feel free to shout if you all need to get my attention as I share as my screen share goes up. Let's see. There we go. So lastly, way back in September in the first meeting or re-meeting of this working group, you all decided that you wanted to consider kind of what funding might be recommended to support Act 148 policy changes. And so that is what this section moving forward will be. As we started off, just as a reminder, in before times, pre-pandemic, Ellen presented to you all a list of what our phase 1 team recommended for critical investments into all of their policy options that they presented to you all last time. So this was before, my understanding was that this was before there was a bill draft in very early January of 2020, with the entire package of policy options recommended. We put forth a variety of places where we thought Vermont could really support policy changes, and really all aimed at this idea of better supporting people on community supervision to reduce failure rates, reduce those violations, and support behavioral health needs. So way back when, we recommended establishing a protected, dedicated fund to support evidence-based programs and services that reduce recidivism and improve behavioral health for your criminal justice populations. And under that was a variety of sub-bullets that this dedicated fund would go to, including expanding risk reduction programming for your medium and high risk people in DOC custody, increasing gender responsive programming, strengthening and sustaining domestic violence programming, targeting gaps in behavioral health services in the community, and identifying housing needs and additional supports. We also recommended expanding DOC data capacity and expanding the community outreach program that embeds social workers with law enforcement agencies statewide. A lot has happened since you all saw the slide the first time. I wonder if folks remember it and it looks familiar, or if it feels like it's coming from a different world. Some of these things have actually gotten their own funding outside of Justice Reinvestment. Some of these things are still out there needing support, but also Vermont's budget situation changed significantly when the pandemic hit. And so the purpose of this section that I'm going to walk through is to think through what these critical recommendations were, and now in this current environment, almost a year later, how could Vermont prioritize its funding to support Justice Reinvestment 2 policies if funding is available? And I just want to recognize from the offset, I know that we're not in a rosy budget situation right now, and that could be a really big if there's funding, because of all the other critical work that needs to be supported in Vermont, and the fact that the state just really needs to keep the lights on right now. We're not in a great environment to ask for a whole lot of money, but if there's resources available, the CSG team wanted to guide you on how to prioritize supporting these policies so that you can really support those people on community supervision with behavioral health needs, and to kind of stop that revolving door of people cycling in and out of prison because of their untreated needs. So way back pre-pandemic, the first version of S338, which became Act 148, did propose a $2 million investment in community-based programs. So that was $600,000 to evidence-based community program, $400,000 to support domestic violence programming, and $1 million to go in reentry housing. We all know that this just couldn't become a reality due to everything going on right now. However, Vermont actually did something pretty amazing and wonderful in that support for Justice Reinvestment 2 policies were not forgotten. And in the end, in the budget that was passed in October of this year, there was funding put towards justice reinvestment policies using unexpended funds from out-of-state prison beds. So you'll see at the bottom paragraph of this slide shows you the exact language that was put in Vermont's budget that allows out-of-state bed savings to go towards supporting Justice Reinvestment 2 policy changes. And quite specifically, it says that these funds may only be expended on community-based service programs approved by the Joint Legislative Oversight Committee. So although this $2 million was not realized, Vermont still managed to make an incredible investment considering everything going on in the world right now in these policy changes for FY 2021. So we're still not totally positive on exactly the exact number for that what those out-of-state funding bed savings were. And as far as I know, although please folks pipe up if you have additional knowledge from me, that funding has not been allocated yet. But our understanding of conversations that have been going around that were happening during the budget process and then have been going on since this funding is allocated is that there is a sense that most likely these out-of-state bed savings for FY 2021 will be reinvested specifically focused on domestic violence. So in domestic violence intervention programming, specifically supporting programs that are ongoing through the Vermont Council on Domestic Violence. And then also on the domestic violence focused deterrence pilot program that the Department of Corrections is starting. So moving forward, perhaps there are two different types of funding that Vermont can look forward. One is that those out-of-state bed savings were only allocated for FY 2021. So if there are additional savings in FY 2022 or after that in out-of-state bed savings, that money could be continued to be reinvested in these in supporting these policy changes and those community-based services. Additionally, if there's any funding available, Vermont could choose to put additional upfront reinvestments in the form of appropriations in the FY 2022 budget. So that would be new funding rather than reinvestment funding, understanding that Vermont is in a very delicate budget situation right now, and this may not ultimately be possible. But if it is, and if you all just happen to have some extra funding lying around, we wanted to make sure that you all understood exactly how we would break down that initial list from phase one and prioritize it in the current environment. So here are our recommendations for what totals to $1 million supporting justice reinvestment, split into 4 categories. So first off, we recommend continued funding for these domestic violence intervention programs that will hopefully be supported this year with those out-of-state bed savings that I just mentioned. These programs really do need ongoing investments. It's not a one-time kind of funding infusion to make sure that they're high quality and sustainable. Along with that, we really would like to emphasize here the importance of having a variety of programming responses available that effectively respond to different types of domestic abusers. And in order to do that, it's really imperative that Vermont does not rely on fee-for-service programming. So the amount of fees that can be generated from clients undergoing domestic violence programming just really cannot support the level needed to have effective programming. And it's important that Vermont moves away from this funding model. Secondly, and you'll see here that the majority of the funding we're recommending really goes to targeting gaps in behavioral health services in the community, which I'm sure is no surprise given everything that David has said previously. We really think that your funding, should funding be available, the vast majority should focus on increasing those mental health, substance use, and co-occurrence services in the community. You'll recall from David's part of the presentation that overwhelmingly people from mental health and with mental health and substance use needs are the people returning to prison and in part of that cycle. So we recommend that you continue looking at where there are gaps in services and expand programming through a combination of telehealth and satellite offices, and additionally invest in improving the quality of your existing programming to ensure that people on community supervision are getting the behavioral health services they need in order to reduce their failure rate. Next, we're recommending investments in data-driven decision-making and really improving DOC's ability to regularly collect, analyze, and pull data out of their system. I want to note here that we only have $100,000 written devoted to this, and specifically in this recommendation, show it going to DOC within the chart. But it's really important that I highlight for you the sidebar of this slide. So the Racial Disparities in the Criminal and Juvenile Justice System Advisory Panel, who you all know as RDAP, has been meeting regularly and just doing a huge amount of work towards Section 19 in Act 148, so part of Justice Reinvestment 2 policies, and the statutory tasks that they were assigned. And they've been looking at, how to connect all of the different criminal justice data systems and where Vermont should really be thinking about how to analyze data related to racial disparities and other criminal justice challenges. How can you use data to pinpoint challenges going on in the system and improve it? They've just put an enormous amount of work to that, and they do have a report due on December 1st. So next week, the legislature will be receiving a report from them about all of that work that they've been doing. And within that report, there will be a recommendation that requires funding. They will recommend supporting the state's effort to better connect and analyze data systems across the criminal justice system with 3 research staff. So although we don't have a funding amount, I want to lift that up. I think that that is an important component of Vermont increasing its data-driven decision-making capacity and really understanding what is going on in the criminal justice system, particularly related to racial disparities and disproportionalities. So lastly, but certainly not least, we continue to recommend that Vermont puts funding towards strengthening transitional housing for people in the criminal justice system. So in Vermont, there's a need to both strengthen the transitional housing provider practices, so of your existing housing providers, and increase your housing stock. DOC is in the process of reworking its RFP for transitional housing providers, partially in response to work done by the CSG Phase 1 team with folks in Vermont that really highlighted the churn of people in housing who get kicked out due to relapse in their behavioral health needs. We recommend that funds go to training these housing providers to better understand how to work with the criminal justice population and move towards a housing first model. Additionally, to help with the housing stock, we recommend the creation of a financial pool to encourage landlords to take risks on this population. So this would be a tool that would alleviate landlord concerns about tenant turnover or damage to a unit, as landlords would be able to recoup losses that they incur, which would hopefully bring more people, more landlords into the transitional housing market. And also you'll see on here a need to support better assessment tools to identify the housing needs for people in the corrections population, both on community supervision and returning from prison. So again, I will remove the screen sharing so that you all can look at each other in case anyone would like to comment on any of the CSG's recommendations for potential future funding or talk about their own reinvestment priorities. or any just questions for me or the CSG team or for other folks on this call. I see a lot of people actually on this call, such as Derek for housing, or a variety of folks who work in behavioral health who actually can help flesh out these ideas. And you have your own content experts in the room, so please, start lobbing questions at us about any of the details of these four priorities. And Derek, would you like to jump in?
I'd be happy to. It's again, Derek Mio Duffner with Vermont Department of Corrections. Sarah, thank you for this whole process and for taking us through that. Indeed, I think when we look at the realities of a state with a less than 1% vacancy rate, while it would be nice to think that the solution would be more housing, I mean, that's a problem that goes well beyond the corrections population and is all the more acute for our population because they tend to be lower on the priority list. So to that point, I think that landlord risk pool really is a way of trying to better incentivize landlords. This is a public issue that has a disproportionate reliance on a privately held asset, which is housing. So we're really doubling down on how these programs can better retain folks and taking a much more trauma-informed and restorative approach to what are the conditions in any of our lives, including these programs that make us feel dignified and safe and stable, and that we have efficacy, that we have agency. So when you mentioned that RFP process, Sarah, it's built around those values. And then we are very clearly broadcasting to our hopeful grantees that those are the things that the state is now looking to procure as core programmatic components. So that RFP process is really going to be built around show us how you are manifesting these elements that in our theory of change will result in better retention and better transition to permanent supportive housing. So we call that reentry housing because we're really also reorienting our portfolio over time to not just thinking about it as housing that gets you out of prison, but gets you into a permanent supported housing, which becomes part of the broader continuum of care of homelessness services in Vermont. So just to give that some more context. And then if I may, one other thing that I'd also like to surface, which is maybe a little less obvious, but from my perspective, no less potentially effective, is that we have this amazing infrastructure in Vermont of community justice centers statewide. And our usage of these justice centers to date has been specific around folks committing low-level offenses and they go through a restorative panel process, or folks re-entering, and we use circles of support and accountability. But we have every reason to believe that given the resources, the applications, and the restorative approach that the community justice centers are poised to provide could really be a stabilizing force. So for example, our justice centers could work with our housing providers when there are house infractions that historically might threaten to send somebody out of the house. A restorative intervention would really transform that into those conversations about, how are you held in community and what are your obligations to this house and to this program. So I would also put in a plug within that construct of funding as to how our justice centers could provide technical assistance and direct interventions to undergird our transitional housing programs. Thanks for hearing me out on that.
I'd like to jump in. I always love following Derek's brilliant comments. I'd like to jump in and just talk a little bit about what's happening with the domestic violence accountability programs in our state. Because of using COVID relief funds in collaboration with the Department of Corrections, the network, along with the Vermont Domestic Violence Council, has been able to provide funding for those programs, funding that they have not had. So one of the issues that has been surfaced through this work and through the research of the Council of State Governments is that domestic violence accountability programs in our state were really reliant only on the fees of the participants. So we've been able to backfill using COVID relief funds some of their funding that they lost about 5 years ago. And when I say backfill, I mean they've been able to get some funding to cover their expenses in 2020. We've also been able to use COVID relief funds to engage the National Center for Court Innovations to take a look at how these programs operate. They operate based on a set of standards, and those standards were pretty outdated. And so we've worked with the Center for Court Innovations to really revamp those standards and to make them not only evidence-based but founded on a set of values. And this is going to have real implications for how these programs operate and bring them in line with modern thinking about how to deal with people who use harm in their intimate partner relationships. We're also we're able to use this money to take a look at how to get an assessment for how we can move forward, how we can think about people who use harm in their intimate partner relationships in terms of their risks that they present, as well as the potentials for behavioral change. So really a small amount of money has made a really big difference, and I really deeply appreciate the inclusion of ongoing funding for these programs. This is what we've got to actually help people change their behavior and stop using violence and coercion in their relationships. And we want to make these programs as strong and as effective and as integrated in our communities as possible. So thank you.
There are a couple observations from corrections on investments. And Karen hit on one of them, and I appreciate Derek's overview of corrections on the housing piece. Housing's important, and I hope folks heard just how challenging it is in Derek's shop to locate housing. It's not as simple as we're going to put money in housing. There are very big challenges finding housing for our population, and Derek is doing a great job as we rethink and reinvent a new version of what housing ought to look like. To Karen's point, we also have taken some funding from the federal government as a result of the pandemic, and we've engaged the National Network for Safe Communities at John Jay College. And we're in the very early stages of the conversation. We have a point of contact inside corrections, and we're working with Professor David Kennedy on 20 years of research around intimate partner violence. And we're starting to build out what we think will be a pretty good opportunity to model in at least 2 sites around the state. Some well-researched work around changing behavior of individuals, especially the high-risk domestic violence violator, and focusing in on that. The one thing I would caution us about just putting up where should money go. The data is very important. We spent a lot of time inside corrections in especially the last 6 months, looking at data and trying to figure out how to better use our data internally. And ongoing conversations are going on about how can we leverage resources internally without additional funding to be able to build better data. But the data is important because, and I'm not being critical here of prior, the way money is spent on programming. But going through what we spend on programming and correction, I think it's around $6 million a year. And don't hold me to that, but it's somewhere in that ballpark of $6 million a year. We really have to be careful about how we spend money on programming. I look at some of the programming that we're spending money on now, and I question staff about what's the outcome. And so here's my point about putting more money at programming. We should be only spending money on programming that has been demonstrated through evidence that it's effective. Because otherwise, we're going to continue to throw money. And what I see in some of the programming is someone comes forward, someone who's a decision maker, they have the latest idea on how they can affect work inside corrections, and we throw $100,000 at it. And that 100,000 adds up to $6 million over time with various programs. So I caution us not to run out and just the latest idea comes along, and that's what I was hard to hear Karen talk about with the courts taking a look at what's really working. And Karen and I have had this discussion privately, and that's why she's supporting our efforts to try to build out the focused deterrence model with John Jay College. So it's just a couple observations and a couple points about where money should be going. And it's simple as throwing money. In my last comment, I want to emphasize from corrections standpoint, the place where we need investment is that 51% of what David was talking about on the returns. Substance abuse, mental health issues. Substance abuse, mental health issues. It's accounting for 51% of our returns. And if we don't address that, we're not going to address, there's underlying issues even in the domestic violence world around mental health and substance abuse. If we can get focused in on that, we're going to make a big dent on what's happening inside corrections. So thank you for the time.
Yeah, and I can't help because of who I am and the person who thinks about data so often. I just can't help but piggyback on that and perhaps sadly remind you all that CSG is just not around for very much longer. We'll be here through about the end of 2021, but part of this data recommendation is that we want to make sure that you all are able to get these analyses that you find so valuable and regular reporting that you need in our absence. So I think there's a lot of work that our research team did with DOC that was really a ton of work in order to make this data usable and presentable for you all that we would love for the state to build in-house capacity for. And that also RDAP has really been looking at the state of Connecticut's model for how they connect their criminal justice data. And you'll hear I don't want to take Dr. Nesrat-Malango's thunder or the report that's coming out, but they've been looking at the state of Connecticut as a model for how to connect and integrate criminal justice data. And those things are just so important for you all to understand what's going on in your system over the long term when you don't have folks like us running around the state able to facilitate these things. So there's really some important progress that can be made for Vermont on data.
Sarah, I had a quick question. So you've prioritized some of the budgetary items. How much, if we don't make those investments, how much does that change CSG's original models and projections on future savings in the corrections budget?
That is a really good question and not one that I think I can answer off the top of my head. I mean, we projected a range of savings based on reductions in recidivism. And so I don't think there's a straight line where like, if you do just this one thing or fund this just one thing, you can expect a specific drop of recidivism. That's why there was a range of outcomes, but certainly supporting people and being successful in community, we strongly believe, and the evidence shows us, will increase your likelihood of reducing recidivism, or will reduce recidivism for you all, and then therefore you should be more likely to really achieve those impacts. But I don't think I can draw that direct line, Pepper, of if you do this thing outside of a larger policy package, it will drop this much.
But isn't it true that I think it was just that chose not to reinvest any money as compared to other states that did reinvest money? I mean, I'm not saying where particularly, but at least the effort wasn't there in I believe it was Kansas. Correct me if I'm wrong, Sarah.
When we look at like the 30-some states that have done this, I think there's been wildly different reinvestments. But yeah, certainly if you are, supporting this with funding, I mean, as David said previously, like this can all not be just procedural changes. Supporting funding will definitely strengthen your efforts and give you all the tools to help make those recidivism reductions. It's definitely no one can imagine funding hurting this process. So, we appreciate a lot that Vermont has already put funding towards this with those out-of-state bed savings, and any additional supports you can provide will only strengthen the implementation. So we're at 11:59, and if you all noticed in the slides that we sent you yesterday, there's a whole section on next steps. I'm not going to share my screen and pull those up. I'm just going to quickly remind you all that you all have a report due to the legislature on January 15th. We all are meeting again on January 11th. So our plan for the working group report to the legislature is essentially to put together a slide deck of the greatest hits from the 4 presentations we give to you all. Let you all review it, and then that will be kind of the compilation that's submitted to the legislature as that statutory requirement. If anyone has any objections to that, please contact me or Chief Justice offline, and we can talk through what that, other ideas for what that report should look like. But the plan is, compilation of PowerPoints, but not all 4 PowerPoints back to back, because no one wants to read 4 PowerPoints. Getting the most important slides there. In the next meeting, as the chief mentioned at the top, and now I'm so sorry, we've run out of time and don't exactly have the time to discuss, but we think we need additional timing for the January meeting, because on top of doing these conversations, we're also going to be having report outs on implementation progress from DOC, from the parole board, from RDAP, and AHS, all on all of these things that they were required to do over the fall or in 2020 with the enactment of Act 148. We want to give time for those updates along with these discussions of additional policy recommendations and what the work looks like moving forward. So we've recommended to the chief to increase that meeting to 4 hours. And he's recommending starting, I think, 8:30 to 12:30 or 1, giving at least 1, if not 2 breaks for such a long meeting. I know no one really wants to be on WebEx for that long, but we can always end early. We want to make sure we're giving everyone their due to cover not only these discussions, but also everything that's been going on in implementation. So, and I'm seeing nodding heads, but if no one objects to that, you all will be seeing that coming your way too. And Chief, I'm sorry, I'm rushing towards the end, but I'm handing it back to you.
Well, thank you, Sarah. Thank you, and thank you, David. Thank you, CSG, and thank you, members of the task force. I think it's been a very productive meeting. I appreciate everybody's willingness to participate in a way that I think helps to not just shape the conversation, but also hopefully shape solutions that are within our reach. That's what's important. So we'll adjourn, and I want to thank everybody again and wish you all happy Thanksgiving, happy, healthy, safe Thanksgiving this week, and we'll see you again in the new year. Thanks again. Thank you all.
Thank you, Chief Justice Reiber.
Thank you.
Thank you. Thanks, everyone. Happy Thanksgiving.
Thank you.